All right, so I will go ahead. So this presentation really is designed to give you a little bit more background about who your state quality innovation network, quality improvement organization is, and that is Superior Health Quality Alliance, or also known as Superior Health. So as mentioned on today's call, we have myself, Jill Hanson, and Teresa Hostetler here to do this presentation. So from a hierarching sort of an overview component, really who Superior Health is, we are sort of a joint venture comprised of 8 sort of foundational members, which are the organizations, the hospital associations from Wisconsin, Michigan, Minnesota, and Illinois, the Midwest Kidney Network, and then the quality improvement organizations from Minnesota, which is Stratus Health, Metastar, which is Wisconsin, and Michigan, which is an Improve Health. In addition, for this most current, we call them scopes of work, is we've had the pleasure to sort of partner with both QSource and Quality Insights because of the region that we are looking at. So we're very excited to be able to showcase and work with the state of Indiana. What this slide really shows you is sort of, because I mentioned all of those organizations, that really means that we just have a bigger breadth of expertise that we can lean on as we support you in any of your quality journeys. So some of the things that we've worked on, you can sort of see on the left side of the screen are really sort of those areas that we've been able to focus on, and that expertise that we bring to the table that we can sort of reach and connect you with. And then on the right side are really sort of those areas of focus that we've been able to collaborate with communities and organizations on. Most of those are probably not surprising to the work that you are currently doing or have been doing. So really, the quality improvement program itself has been around for a number of years, going back to 1982. And really the ultimate idea behind sort of the purpose of the quality improvement organization is really to support sort of the Medicare beneficiary component, and really making sure at a community level, all members within your community have that care and the access to the services that they need. And so while I say our quality innovation network, quality improvement organization work focuses on the Medicare population, we know that quality improvement work and the initiatives within your home organizations isn't sort of payer type based. So when we work with you, sort of it's encompassing all of your quality improvement work to that realm. I like to show this slide because when we talk about sort of how we've shifted and our partnerships that we have for this scope of work, I want to draw your attention to sort of the dark blue area. So there are 6 states that we call the Great Lakes region. So in addition, while we are sort of positioned to work with the state of Indiana, we're actually also working with 5 other states. And that is sort of that dark blue swath. What that means for you, from your standpoint, is the ability to not only look at and lean into the expertise from Superior Health from an Indiana lens, it goes beyond Indiana, and sort of that networking ability is across all 6 states. And I would say, you know, from a quality leader perspective, I think there's the opportunity in the associations like the Indiana Rural Health Association, that you in a leadership role have the ability to network with your peers. One of the beauties of Superior Health is, as we are sort of focused on this statement of work, we also want to make that same ability for the networking from a peer-to-peer connection within your improvement teams. So they may not always have the ability to sort of do the networking outside of even the state of Indiana. This program will allow them to actually sort of bounce ideas off, like project teams and organizations that are working on similar initiatives outside of the state of Indiana. So just wanted to offer that as well. So, you know, we put this slide up because some of you may have had an opportunity to work with QSource in the past. They have been an amazing partner in the state of Indiana. And I think that's really why when we recognize sort of the expansion of the contract that we have, it made sense to us to say, well, we really need to partner locally. And that's really why we have the privilege now to be able to say QSource is part of Superior Health. And so one of the things that I wanted to talk to you about is sort of our promotion right now is we are in sort of full speed ahead in sort of the recruitment for our most recent, we call it our 13th scope of work. So, and it is a 5-year contract. And so what we want to really promote is sort of your engagement and involvement and participation into that program. And so this slide really gives you sort of what does that really mean from your perspective? So when we talk about, you're like, wait, a 5-year program, hang on. So let me break it down a little bit for you. So these first 12 months are really designed to, so we really want to recruit organizations to participate with us. And so when we think about recruitment, we are looking to recruit hospitals, clinics, and nursing homes. So in our previous statements of work and scopes of work, the Center for Medicare and Medicaid Services had initiatives that were focused, but they were sort of singularly tracked. So we had nursing home focus, we may have had hospital focus, and then we had community focus, which sort of pulled in the clinic side. What is really nice about this most recent statement of work is the Center for Medicaid and Medicare Services recognizes, like I will use the example of readmissions. Readmissions doesn't only impact a hospital. It actually, when you peel that back, you look at sort of across the care continuum within your community, all of the community members that are and the organizations that play into the care that that beneficiary is receiving. So for this statement of work, we are talking about working collaboratively across all of those organizations, which is why we want to, when we talk about sort of having these calls with you to sort recruit you into this project and this program, it's really about thinking about from your systems perspective. And so that first year, like I said, is really sort of teased out to be sort of that you're going to join us. We also look at sort of the state landscape within Indiana. So we recognize that there are a lot of initiatives that you are participating in. We don't want to bring additional things and add things to your plate. What we want to be able to do is to say, how can we understand what you are currently involved in? And how can we look to see if there's a way for us to be able to support that even further to get you to where you want to be in terms of the metrics that you have and in terms of ultimately the patient care that you're providing. And so again, as we think about that first year, we're sort of going to tease out as you're participating is really sort of understanding what are your priorities and where do you want to focus? And then we create sort of a strategy and a plan to say, okay, so these are your focus areas. Let's create a plan. How can we support that work that you're doing? And where does it best make sense? And you really determine that level of how much interaction you want to have with us. Maybe not everything that you're focused on really needs a lot of one-on-one support, but there might be some pieces that you're like, this would be great. Can we turf this over to Superior Health to help us do this component? And so that's what we're talking about. And then we shift into sort of those remaining 4 years is really to say, okay, so how is that work going to happen? And the focus areas that you're doing, how can we regularly meet with you to understand, are we able to support you in the best capacity that you need that doesn't lean into more work on your side? And then really, we also want to showcase, how can we share your successes and really promote that beyond the state of Indiana and nationally to say, these are some great things that are happening in the state of Indiana. And we can showcase that and then share it with other organizations so that they potentially could replicate what you have been able to do in your home state. So not surprising for you, these are sort of, when we think about this contract, these are the areas of focus. And I will sort of say, as you look at these, a lot of these metrics are probably things that you have been already working on for a number of years. I will say since 2020, I think the one area that really has come forward on this work and has become a little bit more focused is really around that behavioral health. We recognized as we were coming out of a pandemic, mental health really is detrimental to individuals and even our staff if we don't allow the time to focus on that. So that is really where you're going to see there's a little bit more focus around sort of the those areas around the behavioral health component. We also know that when we talk about from an organization standpoint, emergency preparedness is going to be key so that should we have anything in the future that comes up, we are readily prepared. And I use the example of prior to March of 2020, I think we had emergency preparedness plans in place. We may not have been as aggressive with reviewing those plans as we are today post COVID. The other thing that we recognize in the Center for Medicare and Medicaid Services recognizes is that workforce challenges are a day-to-day component within an organization. So if we don't sit and talk about those and understand how that directly impacts those other disease-specific areas, that sets an organization up for failure. So that is one of the things that we've also worked into this component of this contract, is really to understand how all of those play a part in the foundation of your quality improvement program. We also, within this next 5 years, we have what's called the Focused Quality Improvement Organization Services. So that is really designed to be sort of a quick, intense support from your standpoint. So you may receive a ding from the state, from a state survey, and you're like, I'm not quite sure how I want to handle this. Let me pull in Superior Health to see how they can assist me, and so how we can address that in a timely fashion so that when the state surveyors come back, we are ready and poised to really say, here's how we're going to focus on this. I think the conversations that we've been having with organizations has been around survey readiness, and that is one of the areas that we can support organizations as they're prepping for this. The other component to this is there's sort of the patient and caregiver also have the ability to sort of shine the light on sort of any safety concerns that they have. So that typically, you may be familiar with that beneficiary and family-centered care. So for the state, it was formerly Levanta, and now it's called Commence Health. So what happens is that complaint would come into the system from a beneficiary side into Commence Health. Commence Health then would work directly with Superior Health to address, and then we would work hand in hand with the provider to address that patient or caregiver, the beneficiary concern. So really, not surprising, I think really what we can do is support the work that you're already doing. Again, we want to stress that this is not designed to add one more thing to your plate. What we would really love to do is be able to say, how can we come in? How can we learn about your quality program? And actually have just an honest conversation about what are the things that are going really well for you and where do you find is your pain points? And then from that, we can sort of tease out together where we might be able to best support you and what does that look like. But again, this really is you're in the driver's seat. I think previously with our federally funded contracts, it really was sort of like this directive of like, okay, so these are the metrics you need to focus on, and there's not really much of a wiggle room. What the beauty about this contract is the Center for Medicare and Medicaid Services recognizes while we have national data and we can see where organizations are struggling or doing really well in initiative specific, it really comes down to it has to be the organization has strategic priorities and they have to be able to be part of the conversation on what they want to work on. And that's what is really nice about this. So while there are some, not surprising, what your data looks like, but where we want to do is be able to come in and complement the work that you're doing. And then again, if we think about from a lens of, from an initiative specific, are there areas that maybe you haven't at a local level been able to connect with all of the community partners that you need? Or sometimes there is sort of the organization, I don't want to say, I will say politically, the sort of the competition with, in the terms of, I'm not, a different health system. And so where we want to come at it from a lens of, when you think about from a patient care standpoint, from a patient's perspective, it doesn't matter to them which health system or which organization they're going to. They just want to receive the care that they need. And that's really what we want to be able to do, is to say, can we find ways to do that collaboration from a community perspective, so that from a beneficiary perspective, they're getting the care and they recognize that their community is special, because it doesn't matter where they go. There's not really the competition piece. The competition is like, can we provide for all of our patients the best care possible? So again, just to let you know, this isn't something that we're going to sort of come in and be like, hey, we're the new people on the block. Well, we are the new people on the block, but organizations like the Indiana Rural Health Association. So really, for us to be able to have the opportunity to come in front of all of you today and sort of share what we are doing, we want to work with the local agencies and become a partner within your state, and really sort of look at it from a lens of not recreating the wheel, but where can we sort of collaborate with existing initiatives, and where can we help to enhance the programs that you already have in place. So this really just shows you, in our previous contract, I would like to say that we were able to do this. This really isn't the work of Superior Health. This is the work of all of the organizations that participated with us. So with the ability to us to be able to support those organizations, we were able to showcase to the Center for Medicare and Medicaid Services these beautiful results that you see in front of you within our communities that have been part of the work. So as I mentioned, when you think about from the lens of what could the quality improvement organization do for me, it's really about creating a customized approach that is unique to your organization. And I think that is one of the beauty parts of this initiative that we are focused on. And the other part is, I think back in the day when I was back years and years ago, sort of working on sort of national initiatives, it really was like, you're going to listen to the same 6 webinar series, and it might be the same person in your organization that's tapped to all 6 initiatives. But what we want to do is be able to say, where can we utilize your initiatives and within your departments and your teams to get their input and allow them the opportunity to be able to do the networking amongst each other and with other organizations, and be involved in addition to all of the technical assistance. So it isn't just one point person within an organization that has to funnel that all down. It's actually us being able to engage as well with those care teams that are focused on that initiative work. So again, we showcase this because we're bringing a variety of learning platforms that you can utilize that are not sort of, it has to be the same webinar on the same Tuesday that you may or may not be able to attend. So that said, I wanted to put this slide up, and we will also share the slide deck for you kind of post review. But if you are thinking, you know what, this sounds great, I mean, you can hold up your phone and scan that QR code, and it'll take you right to, here's to enroll with us. The other piece of this is really, if you have questions, I wanted to include this slide because, while Tara is not on the call today, myself and Teresa are happy to answer any questions that you have. So at this time, I'm just going to go ahead and I'm going to stop sharing so that if we have any questions, we can answer those on the call today. And I will just offer, Teresa, was there anything else that you wanted to add related to our presentation that I may not have covered?
Jill, thank you. You did a great job. Yeah, just high emphasis on we're here to support you. This is not an added burden for you whatsoever. We'd like to compliment you, partner with you, and in a lot of cases, able to showcase your successes as well. So, um, would love to work with all of you and appreciate your time. Thank you, Jill.
We do have a question that has come in the chat, and that is, what are the contact emails for the Alliance team? How can we reach out? I think you did have one on your slides there. Jill, if you want to reshare that QR code, a couple folks are asking if you can put that back up. I think that was the slide that had the QR code, and then possibly post the slide with the um, email addresses as well.
Yep, absolutely. All right. I'm going to first show you so here's our contact slides. Again, I will also send these directly to Allie afterward. And then if she's able to sort of send out that PDF of this information. So,
Absolutely. Yeah, I've got the slides already and I can share those. I'll even share the link to today's recording so folks can rewatch if there's anything there. I'm going to go ahead and end the poll.
yeah, and I also have that sort of the enroll with us. We've also been offering, so if you're thinking about, that was great. It was a great presentation. I've got a couple more questions. We've been scheduling like a 30-minute call. I will say the slides are probably going to be a little similar to what we showed today, slightly different, but again, it just allows you and your quality team then sort of a specific one-on-one. And then as you think about more questions, we can have that in those one-on-ones. So if that is also something you're interested in, so I've got this code. I'm just going to pop back to this. You can reach out to any one of us, myself, Tara, or Teresa, to say, I would love to schedule a 30-minute call with you. And we go from there. And like I said, it's been a great way for us to not only meet organizations in Indiana, but really to just be able to provide a little bit more one-on-one conversation outside of a recording such as today.
Another question has come in. I'm a mental health provider or a provider in mental health. I'm curious about the mental health piece and initiatives. Is there somebody that I can talk to about that? And she also says she is not in any quality team for her agency in Indiana.
Yes, absolutely. If you want to, again, if you want to reach out, you can reach out directly to myself. So if you want to grab my email off of the screen, I would love to have a conversation and talk to you specifically on the behavioral health side. Yes, absolutely.
Any other questions? Again, you can raise your hand if you prefer to ask your question verbally. Okay. Not hearing any more, I am going to go ahead and stop the recording. We do thank everyone for joining today. Excellent information for everyone. We can hang on the line just a moment if anybody has questions they're trying to put in, but thank you everybody for your time and hope to see you at our next Lunch and Learn.